If you're an insurance-based practice and you're not evolving to cash-based medicine, you will become irrelevant in the next 5 to 10 years. This evolution of food is matching the evolution of people being busy. Let me go to the grocery store and get $2 bread, which is not even bread. It's literally disgusting.
Do you think healthcare workers are relying too heavily on the technology that's out there right now?
I think technology is a guidance. Do I think technology should take over medicine? No. Humans are still human. It is no longer an option for you to ignore how medicine and aesthetics is all interconnected.
How do you think the gut affects us mentally?
The latest topics in wellness and aesthetics. Yes, that's right. We're talking about that today on the show with my good friend and counterpart, Alicia. And we're going to be walking through all of the amazing topics that we've actually been asked repetitively. All these DMs have been coming in, and we're going to address those concerns and those topics and all of these different trends today. And we're going to be actually doing things a little bit different. But before we dive in, make sure you hit subscribe so we can dive through all of these things together continuously. And I want to hear from you as we go along this journey of improving patient care, but also improving your businesses along the way. Alicia, how are you?
I'm great. It's good to be here again with you, Sam.
Well, hey, we're going to do things a little different. It's going to be you moderating me. So this is going to be fun. Don't throw too many curveballs at me, but I know we had some hot topics that have been coming into us. So Alicia, I know we're going to be going into these topics that you've accumulated from all the people asking. So hit me, what you got?
Yeah, well, the first thing I want to talk about is personalized medicine and tailoring treatments to the patient's needs.
Yeah, hey, personalized medicine is something that I think is continuously on the rise. I personally like it. I think we've mentored a lot of our clinics to think about medicine, aesthetics, wellness, all by personalizing it. Medicine is evolving so fast because of technology. We have access now. We have AI. Medicine is more sought after because people want to know about their health. We're in a data era, right? Everyone just wants information. And with information, now we can get blood work done. So many panels of it. We can DNA methylate. There's so much information we can get. What do we do with this information? Well, that's where personalized treatments happen. Whereas before it was, oh, you don't feel well. I think this will help, or this might help you, or this should help you. Now it's, let me figure out exactly what's going to help you by looking at your blood work, by looking at your DNA, by looking at all the different things we can test for, not just with blood, but also with imaging. This is a very exciting topic because individualized and personalized treatment plans is necessary, not just in medicine, all of healthcare, aesthetics, wellness, hormones, surgery, everything is now individualized. And honestly, people are demanding it.
You know, they absolutely are. And you kind of hit home on one of the points with the labs. We both had undergone that through a company when we went into like a Quest site. We were able to have our labs drawn pretty deep in depth, like a lot of labs outside of what our traditional providers would normally order for us. And it broke it down into every lab, that results that came back, and told us each result and what that meant. And a lot of clinics don't offer that to their patients. They say, here's what the labs are, here's what your results, but they don't know what all these different letters and symbols are in their blood work. So that's what I really liked about this one particular company, because it told me what this lab was, where my results should fall, but then furthermore, what exactly this is and how I can further treat it. So then of course, I want to go on, I want to Google what type of supplement I need to be able to increase my numbers, because I want to have the best numbers. I want to be able to have a reduced age when that comes back. And I think that you start to get a little bit more competitive with yourself and how can I improve my internal and external health. How did you feel about your lab results that you got? And then furthermore, how did you dive in?
Yeah, no, I mean, I'm glad you asked. And honestly, it was a wake-up call for me. You know, if I were to go to my usual PCP or physician and say, I want all this blood work, it would never happen. Because why? I wouldn't qualify for it. There's no need for it. There's no ICD-10 code for me to get 200 lab workups, my different vitamins, my inflammatory markers, my allergies, all the different foods, seasonal, all the different allergies, and if that's changing how I feel, all the different inflammatory markers, as I mentioned, all of these things. If I go to my PCP, there's no way in hell they're going to give me these labs because my insurance won't cover it. So I said, hell with that. I don't feel good. I'm going to pay cash. I think it was $500-600, and I paid it. It was Function Health, an amazing company that's just got funded for millions of dollars, and they are giving people access. I pay out of pocket, which I'm more than willing to do because I want answers. The answers that my insurance company won't approve for.
Especially if you have a high deductible and you have to be able to meet that first.
Yeah,
it's like,
there's
okay, let me
no
meet a
way.
$5,000 deductible in order to get answers.
Absolutely. That's why personalized medicine is on the rise, because people like myself and you want answers. And if I can pay a company such as Function Health, they do all of this amazing blood work, not just give me data and give me levels of my different lab values, they also give me recommendations. patients, they'll say, hey, based off of all this blood that we've pulled, all the different lab values, here's how to correct this. Here's how to correct that. Here's some advice, because there's a whole medical group and physician that looks at it, writes a report for you. And of course, it's not to take over diagnostic care, it's to supplement it. So you can take that and go to your medicine doctor or go look things up online. As you mentioned, why it was a wake-up call for me is because it gives you a rough AI-driven indication of your health. So it takes all of this, hey, this is your CBC, this is your all the different sort of lab outputs, this is your liver enzymes, this is all your diabetic markers, your cholesterol levels, this is your inflammatory markers. And then it says, based off of the AI algorithm, per your age, per your height, per your weight, and per your history, this is what age you actually are. And that's where I got slapped in the face because it was 5 years older or 6 years older than my actual age. And I'm like, oh, hell no. I am not going to be in my 40s. Not that there's anything wrong with being in your 40s, but I'm in my 30s still, and I want to remain in my 30s, right? I'm competitive, and I want to make sure that I am my own age, not older. And what am I going to do now? Well, I've already done it over the last year. I looked at what vitamins I was low in, bought them, been taking them religiously daily. I looked at my cholesterol, and unfortunately, for the first time in my life, it was actually high. And I said, I need to make some changes. So it's a wake-up call, but I wouldn't have gotten that wake-up call until when? Until it was absolutely necessary when I was ill, and then they happened to take my blood work. Then it's too late, or
I wouldn't have had all that blood work taken if you went to the hospital. Traditionally, it would have just been ordered based on what your symptoms are, not to be able to look at maybe some other potential underlying conditions that you might have as well that are often missed.
Absolutely. That's why I'm a huge fan of this personalized care. It just makes care better. It makes it, once again, individualized, because each of our bodies is different, right? If your vitamin D is low, my vitamin D is low. Yes, low, but how much should we take? How long should we take it for? What form should we take it? Is it going to be absorbed properly? Do I have a gut issue where it may not be properly absorbed? So there's so many factors, and that's where generic, sort of generalized medicine is not so much emphasized. And now this individualized medicine is on the rise. And now we have AI to help kind of give context to, hey, we pulled all the data for these types of millions of patients of data, and starts to algorithmically make predictions. Once again, not to take over diagnostic care, but to give us guidance that insurance companies can't give, guidance that many medical providers can't give, not because they don't have the knowledge, but because they don't have the data. But now I can go pay for it. Individualized medicine is on the rise, and I'm a huge, huge fan of it.
Do you know what I like most about that in your situation with Function Health is after you had all that, you got all your supplements, you were taking everything religiously, like you mentioned, but then I know that you had like a 3 or 6 month follow-up, and you were so excited for that date to go in for your blood work, which I've never seen you so excited to get stuck with a needle, but you were excited to be able to see your outcome and with how the opportunities had changed with your health. So how were your numbers, your age? Did you decrease?
Things have improved. Okay. And, I think that you're absolutely right that getting your blood work is a frightening thing. It's not something people want to do because physically it's not fun, but also psychologically it's not fun. But I knew that several months later I had made some changes, and I was encouraged and I was motivated and I was competitive to see how was I going to improve. Vitamin D levels went up, your inflammatory markers go down. Is there still room for improvement? Absolutely. But now I see the tangible results. I see the improvement. Guess what I'm going to want to keep doing? I want to keep improving. I want to invest again in this company and say, hey, I want my blood work taken again. I want to individualize my care. Otherwise, if I just go Google or if I just go ask a physician, they're just going to give me generic advice because they unfortunately can't draw all these labs. Where if I get personalized care, then there's a game changer. And then there's you can go into pre-cancer cursors and check to see if there's some sort of component of that in your future. And I think this is important. I think that we see this when people are trying to conceive or get pregnant. Hey, am I going to have any issues with this baby? I know there's a lot of ethics behind that. There's a lot of mixed opinions behind that, but I think that technology has given us the opportunity to individualize our care. And, I think that it's something that needs to be adopted, and I heavily, heavily encourage it.
Do you think healthcare workers are relying too heavily on the technology that's out there right now to be able to fix some of these patients' concerns?
Yes and no. I think that AI has given us access to a whole bunch of information, and it's done it in a very petite, quick, within seconds, I get all of that. Whereas if I were to go read every single textbook to get answers, it would take me a lifetime. So I do think that technology has given the ability to give better answers. I think technology is a guidance. Do I think technology should take over medicine and take over healthcare workers and their mindset and their actual cognition? No. Humans are still humans. We still have to have a conversation. There's a lot of emotion when it comes to health. What are the influences of why your health is bad? Did you have a recent trauma in your life? Did you have a recent change in your life? Did you get let go from your occupation and then your health spiraled downwards? These are things that we obtain with the conversation, not with ChatGPT. These aren't things that AI yet can figure out because AI doesn't have emotion yet. And so we have to make sure that we still have a human component. The human touch is so important and it's critical, but we use technology to help guide and enhance the human touch. And that's how it should be looked at.
I even think like years ago when virtual appointments started coming about, people were super excited about it, but they were also like thinking that they weren't getting the same treatment. And I think that kind of hit home on the human touch is very important. People want to have a face-to-face conversation. They don't want to have it virtually, and they don't want to have it nowadays with like an AI assistant because it is so important to be face-to-face.
Yeah, I mean, humans are creatures of community, right? We've always been together. We've always thrived together. We're not creatures that go off on our own, right? We're not apex predators like the shark that just goes and does its thing. We work together. We need collaboration. We need face-to-face. We need personalization. We need that touch. And digitizing that is going against sort of our generations as a human being. And so we have to make sure that we continue to have personalized engagement, personalized touch, face-to-face. But we can't ignore the fact that technology has given us the capability of learning, the capability of enhancing care, but we still have to have that human touch. We can't do that by a robot.
I want to kind of switch to the next topic that came in with the connection between gut and brain health. How do you think the gut affects us mentally?
This is a personal topic because, you know, I've had a lot of gut issues. And when I open up my healthcare playbook, everyone's gonna be like, Sam's got all these health issues. I don't. I think I'm human, right? I'm aging, and I think I don't have the best diet I wish I did. I need to do better. I travel a lot. And I think that gut for me has become a very important topic because I'm starting to see how my gut certainly impacts my brain, impacts my emotion. And this topic of gut to brain or brain to gut health has been around for ages. I mean, the naturopathic physicians have been talking about this for decades.
It's been dismissed so often.
Absolutely, it's been dismissed. It's been dismissed because of westernized medicine. It's, modern medicine is pills, surgery. But if we look at naturopathic or holistic care, it's really what we eat. What we eat impacts how we feel. And in today's world, foods are ultra processed. There's a lot of filler. If I go to fast food, if I eat something out of a can, there's a very limited amount of nutrition.
So much preservatives and sodium, and it just kind of like really bogs you down for the day. I know like when I'm having a healthy meal and healthy, like clean choices, I feel great the whole entire day. I have more energy, I have more mental clarity. And when I make a poor choice because I am on the road and I know it's like not the best option, I'm fatigued for the rest of the day.
Yeah,
it really does affect me.
Right?
Yep.
I just ate. Why do I feel like absolute crap? I feel tired. I feel bloated. I feel like I just want to take a nap, and my motivation gets lost, right? That's from the gut. That's from you eating this food and your gut not reacting well to it. And inflammation is really the stem of all this, right? If we inflame our bodies more, our bodies are going to biochemically be imbalanced, and biochemically being imbalanced is going to mess with our emotions. It's going to biochemically imbalance your brain activity, how you are able to release certain neurotransmitters. All of that is coming from our gut. So our gut significantly influences our emotion, how our body is able to recover. If I went overseas, for example, Italy, Spain, and you eat the food there, I mean, you feel like $1 million. You can eat a whole pizza and feel like you ate nothing because it's so pure. And you could go on a hike, you can go enjoy life. It feels good. If I eat a pizza here, I'm taking a nap, I'm out, I'm on the toilet. I mean, that's TMI, but it's true. It's my body doesn't react, in my mind, then I feel sort of down. I feel like, oh, am I depressed? I snap out of it. But hey, our gut and brain communication is so important. And now we are actually addressing it. It's important to eat well. It's important to keep track of that. But it's also important to understand that there is a connection there. It's not just, oh, I eat something and my gut is angry. No, your gut being angry is going to make your brain off balance. It's going to make everything else off balance. It's going to change your hormones. It's going to change how your body is either stressed or relaxed. And that's entirely based off the gut.
You don't feel like this is just a trend right now that people are on this bandwagon right now and then it's going to change? Or do you think it's just finally catching up to us and how our body and mind connect?
No,
and this is going to continue to evolve?
I do think it's a trend. I don't think it's a trend that's been new. It's been around for decades. Modern medicine, Chinese medicine, all these different aspects of medicine have talked about this for generations, for centuries. It's now becoming trending because our food is becoming worse. You're seeing a lot of this online of like, these microplastics in water, hormones that are pumped into the meats, pesticides that are on our vegetables. Now it's becoming more sought after and discussed because our food is becoming more industrial, right? It's made in a factory. Is it grown? And I go to the produce store and I see these green bell peppers that are this big. I'm like, what the hell is that? Why is that? And then you go in the organic section and the bell pepper is small, like it should be. And so I think that because food is evolving and because things are becoming more industrialized, becoming more biochemically altered and beyond meats and all this bullshit that's out there, all of that is causing it to become more discussed. But the topic's been around for generations. It's just becoming more discussed now because our food's terrible. That's why.
And as you know, me, I'm a big gardener. I've always been in that. I love being able to grow my own produce and, share it around with everybody. So that's always been an important topic for me, and eliminate the pesticides and keep a more of an organic garden. Obviously, the seasonality in the Midwest from what we can grow at different times. So if I can preserve something through the year, I definitely try to do that, whether it's through canning, which I will say I think that is a lost art. I don't see many people making their own pickles or their own hot sauce or their salsa. And it's just so rewarding to be able to have something on your shelf that you can pull out that came right fresh from the garden.
Yeah.
You know where it came from. I think that's really important. I wish more people were doing that.
Yeah.
But I do see a lot more trending topics with people trying to grow that, whether they're just planting tomatoes in a little planter box so they have tomatoes through the summer. Have you noticed any food changes that you've been making to try to evolve with your gut health? Do you have any personal stories that you can share? Anything that you've eliminated from your diet?
Yeah, 100%. I think over the last several months, along with this sort of eye-opening blood work I have started to eat a lot more at home as much as I can. When I'm home, I'm trying to eat at home. I'm including more, salads into my diet. Of course, being a vegetarian, that seems sensible. But,
But as most of us know, Sam, he's not big into his salads and greens.
I'm a terrible, terrible vegetable-tarian. Terrible. But nonetheless, I think that for me personally, I'm just more aware. I think, I'm trying to avoid ultra-processed foods. I'm trying to see, are there organic alternatives? Pringles, something as simple as that. I mean, who doesn't love Pringles? But there's a different version of it.
Can't stop.
That's the thing. But there's another version of Pringles. I forgot the name, but they have it at the Fresh Time store where I live. And it's significantly healthier. It makes you feel good. It actually has a lot of flavor, right? And same thing with you. I mean, you provided me this jar of honey because I know you have these honeybee farms and whatnot, and you process your own honey, and I tried that and I'm like, what the hell is it? I've never had this before. It tastes good. Has flavor. It's pure. Whereas if you get processed honey from the store, you're like, is this actually honey? And you read the back, it's like 20% honey. It's like, what the hell's the other 80%?
Ketchups nowadays, I know you love ketchup, but if you look at a lot of ketchups, they have high fructose corn syrup added in it.
Right.
It's like we don't need to be adding that to our food, but we definitely need to be more conscious on the ingredients and the food choices that we are eating.
Yep.
I like how you changed your Pringles for something that was healthier. There's now like popcorn that's like protein popcorn. So there's a lot of other options and avenues that we can go to continue to enjoy the foods that we have, but in a healthier alternative.
Absolutely. And this is all important for not just your gut and nutrition, but also your mind, right? This whole, we live in a stressful time. We live in a stressful environment. It's go, 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 go. Our world is, and I think that's why people don't farm as much, right? People aren't cultivating their own foods because, hey, it's just so much easier to go down to the grocery store and get a $2 bottle of Tabasco sauce, big size from Costco, and call it a day. Whereas making your own hot sauce is obviously much better for your health, but it takes a lot more time. And in a fast-paced society where people are working day in and day out, there's no such thing as stay-at-home anyone. There's no such thing as stay-at-home mom. There's no such thing as stay-at-home dad. I mean, there are such things, don't get me wrong. But it's not as common as it used to be where people had more time because they were at home. People are striving for better careers. People are working. People are well balanced in their families. Women are in the workforce, which is amazing to see. And this whole balancing act has also caused people to have less time. And so why this matters, because people are going to the convenient option, which is canned food, fast food, quick processed food. And so I think that this evolution of food is matching the evolution of people being busy. People are now more busy, so they're looking for convenient options. Let me go to the grocery store and get $2 bread, which is not even bread. It's literally disgusting. Whereas people would bake their own bread in the past, which was nice. People just don't have the time anymore, right? So that's kind of that.
You mentioned hot sauce. How was my hot sauce that I gave you?
You know, everything that comes from your, I always call it a meth lab that you have in your basement. She doesn't actually have a meth lab, but she has an entire jarring facility, and it's quite fascinating to see what you've done. It was actually quite inspirational. Everything that comes out of your house is great, and I know it's coming down to time where you're going to be getting some more honey. So hey, I'm waiting. I mean, where is it?
Let's see if I can get you on the list. For maybe a quart or something.
Yeah. Hey guys, if you haven't had proper honey, or if you think you've had the best honey, you'll have to message Alicia and get some honey from her. So.
I've got a shelf full of a lot of produce, so I'll get it out to you. I kind of want to change a little bit from what we've talked about with the gut health and how medical clinics have changed and evolved a little bit.
Sure.
How have med spas and aesthetic practices started to use technology to enhance experiences in a lot of these topics that we've discussed?
We can use it to actually give patients a little bit more understanding, as we were talking about earlier with their blood work, but also in aesthetics. In aesthetics, there's amazing imaging systems and there's amazing data systems and scales like Staiku, where you can stand on this sort of body imaging / wellness imaging technology, or shape scale, which is also something similar that's new in the market. My personal favorite is for skin in the face, and it's a system called Aura. Aura is it's so amazing, isn't it? This Aura system is made by this big company called Hexagon. And what the Aura system allows for practices to do is really give patients a little bit more understanding of their skin and their face and their neck, a little bit more understanding of it. Because if anyone were to come in and they were to say, hey, I want my fine lines and wrinkles fixed, I would look at them and say, okay, I'm happy to help you, but what about your skin health? What about your pigment? What about your texture? What about your volume? I can give them my opinion, but if I put them in front of an Aura technology, which is this beautiful screen, a screen that allows you to take an image within seconds. It's the fastest on the market. Within a second, I can then obtain information about my face, about my skin, 3D. I can zoom in, which is kind of creepy. You can go into your pore and see what's going on. You can see about the fine lines, wrinkles. Then the patient is now saying, wow, I had no idea my skin was like that. I had no idea my face and my neck was like that. Then what are they doing? They're asking, how can I fix that?
Yep. Well, my favorite thing with the Aura as well is how we're not just looking at the surface, but we're able to look deeper into the deeper layers of the skin and what's underneath of what we can't physically see.
Right.
Such as, how severe a patient's rosacea or redness is underneath, what the UV damage, what the brown spots as we continue to age, what's going to be popping through that maybe are not totally visible to the surface right now. So how can we treat that and be a little bit more proactive so it doesn't evolve to that?
Absolutely. No, it's so important for us to see what's under the surface. Under the surface just tells one story. But to your point, how has the sun damaged you? How is that rosacea improving or not improving? How is the melasma improving or not improving? A lot of people just want answers. And if we're able to show them different types of imaging, different types of, opacities and shades of their reds and their browns and all of that, then they're wondering, oh, what do I do to fix that? So what used to be a Botox conversation now turns into a laser conversation, resurfacing conversation, right?
One of my favorite before and after photos, and tell me what you would think about this, was when a patient's coming in, they're using the technology. Maybe they're just coming in with one concern, but they see everything else like you were mentioning. And then let's say they have nasolabial folds right here that they really hate. And we know that probably losing facial volume within the cheek area. Oftentimes it would be fillers or injectables within that area. We also have M-Face that can tone that and lift that back up, or we can use them both to complement, which work very nicely together. How cool is that Aura can show, hey, here's the volume increase that you've had. Here's the way that the skin has moved. Like that to me is just amazing for a patient to be able to see, I did get an outcome with this. And a lot of times, especially with some technology, patients don't physically see the outcome because it's deeper than what they can physically see when the muscle's toning.
Absolutely. I think that the before and after capabilities of systems such as Aura allow for patients to really have an appreciation for the investment they've made with clinics, but also, it gives more trust to the clinic. The clinic is able to obtain more trust from the patient because now they've shown the results. It's not just a simple iPhone photo. Those days are gone. You can't be taking before and after photos with an iPhone, guys. Come on. We got to improve that, right? The Aura system allows us to show a before photo, do our injectables, do our laser therapy, do our microneedling, and then show the before photo. And you don't have to say a word. The Aura system says everything that the patient needs to hear without actually having to say it because it shows it to them. It shows your volumetric changes. It shows your skin texture changes. It shows the score improving. To our point earlier, patients are competitive with their cells. So if they say, oh my God, my skin score is 2+, I want to get it down to a 0 or 1. How do I do that? We do the treatments and now their score is decreased. Now, guess what? Not only are they excited, not only are they building trust, but now they're coming back in to do more treatments with that practice, all because of an imaging technology. The imaging technology such as Aura is single-handedly the #1 best investment any wellness or aesthetic practice can make, and there is no debate on that.
What I love also about Aura is that it comes from Switzerland. And what's more precise than Swiss products?
Hey, listen. Swiss on my wrist. It is so important to have Swiss made things. And I love that it's from Switzerland and the CEO, amazing human. Everyone at Aura is amazing. And I just think they're the new up and coming company. So, but besides that, I think imaging overall, when it comes to face, when it comes to body, when it comes to anything, if we can give our patients data, if we can give our patients a baseline of where they're at and a follow-up of where they have come to and show data and show images to prove that, that's not just good medicine, but that just makes it very exciting and rewarding. And patients love that. And also they want that. They need it.
Do you think there's any danger of adding so much tech into a clinic and AI technology? Do you think there's any danger in that?
It's a great question. I think that there's a lot of topics that are trending right now. There's a lot of conversations being had about how much can we rely on technology? Are we becoming too dependent on it? But going back to our earlier conversation, I think that technology is a tool. And if it's used as a tool, there's a beautiful, synonymous, synergistic relationship. If it takes over the human and then people become dependent on it solely, that's when we have to be worried. So same thing, if we have technology that does body contouring or technology that does skin rejuvenation, you still need a human behind that tool to make sure it's right for them. We have to make sure there's a human behind it to monitor the results, make sure it's safely administered. You still need the human touch. So I do think that all of these technologies we're talking about are necessary. Do I think that they can become a danger? I think so. Yeah, I think that that's why it's so necessary for them to be used as tools and not for them to be relied on entirely. So once again, I think that the balance is going to be critical as we go into this generation of AI, as we go into these years era of artificial intelligence taking over every aspect of our life. I advocate for it. I believe in it, but only with the component of it being used as a resource, not being used as replacing what we know and what we are supposed to do, which is use our personal touch, use the human conversation. We can enhance all those things with these tools.
You kind of mentioned years. I am thinking of a photo that I recently saw of Alice from the Brady Bunch. Beautiful lady.
Yeah.
She's my favorite in the show.
Good old Alice.
But I'm looking at her from the age of 40 or whatever she was in that photo to celebrities now at the age of 40 and how she looked like a 65-year-old woman to me. And nothing against Alice again, but
Yep.
the way the technology has evolved, people aging backwards, longevity medicine, and how they are taking better care of themselves, not just aesthetically, but internally, that's focusing on that external glow and aging backwards.
Yeah.
Have you seen some of these trends in some of these celebrities from 40 years ago, 30 years ago, and how they looked and how actually people true age look today?
No, absolutely. I love that example too, because you're like, whoa, I mean, people look so different back then. We just talked about this actually. I just got published in the Aesthetic Guide with this exact topic of aesthetics and wellness and medicine are merged together. And what people come in for is skin laxity and fine lines and wrinkles and volume loss. And everyone wants to treat that as solely an aesthetic concern. But there is a wellness component to it. Are their hormones changing? Has that influenced their aging? Are they biochemically imbalanced? Are there peptides that need to be involved in this conversation? Are there vitamins displaced? There's so many factors when it comes to looking past the aspect of just aesthetics. And that's what we're seeing, right? Is that as people are aging now, people are not just focused on looking good. They're also focused equally, if not more debatably, on feeling good too. But when you are feeling good, guess what? You look good too. And that's what we're saying. And that's kind of what that article in the aesthetic guide was all about, was how aesthetic practices are now evolving to include peptides, hormones, biochemical testing, all of this stuff. Peptides are on the horizon in future. And, I know there's a lot of pushback from big pharma, but the reality is they help. The reality is that all of these different things that we can do, not just help with people feeling good and living longer, living healthier, better quality of life, I should call it, but also looking good too.
Yeah.
Because if we take care of our internal aspects, our internal organs, if we are balanced, if our hormones are optimized, if our peptides are optimized, if our molecules are optimized, our vitamins are optimized, all of that's going to influence good tissue, good collagen production, good skin health, good gut health. All of this is going to increase your mental awareness. So mentally, we have better mental health too. And that's what we're starting to see. And I think that there's nothing new about this. We're just more educated. And now I think people are breaking out of the mold of, sponsored testing by big pharma and insurance companies. And people are saying, you know what? Medicine has been handcuffed. Let's break those handcuffs and let's start figuring out how aesthetics and wellness and all these things are actually connected, because they are.
And I think that's why a lot of family med or internal medicine clinics are starting to understand this evolution of potentially losing patients right now, because they're going other places. They're going to all these other clinics that are popping up, not just med spas, but their longevity, their regenerative medicine. And people are able to go to these clinics and get those resources that they can't get from their traditional medical providers, because they are insurance-based. Their method is diagnose and prescribe.
Yeah.
And they're not able to evolve with the technology, evolve with what's trending. And they either try to bring in those cash-based services because their patients are asking for it, or they're losing their patients, or they're trying to find it out of it completely to be able to open up their own space where they can practice medicine how they want.
I think my big takeaway here is this, and this is for all the viewers, is that if you're family medicine, internal medicine, functional, integrative, whatever medicine you practice, it is no longer an option for you to ignore how medicine and aesthetics and well-being is all interconnected. I know you're referring those people out right now, right? You're referring those people out saying, I put you on a GLP-1, you've lost all the skin, or you've lost all the weight, and now you have sagging skin. Oh, let me just push you away. Retain that patient. Give them opportunities. I hear this from internal medicine, family medicine practices all the time, insurance-based clinics. Oh, I don't do that. That's for the med spas. You don't take care of your patients? You don't help them with the concern they have? That's my rebuttal to that, is that if you aren't doing hormones, if you are not doing weight loss, if you're not doing skin laxity, pelvic floor concerns, intimate concerns, if you're not doing these things, you are behind the game, flat out. If you are wondering, why is my practice not changing? Why is my revenue not changing? If you change nothing, nothing will change. So you have to change and educate yourself on skin technology, on body technology, on urinary incontinence technology like Emsella, Emscope Neo, all of these amazing technologies that we are blessed to have. If you're an insurance-based clinic and you're saying that's not for me, you're basically saying treating patients is not for me. We have to up our game. We have to become better.
There are so many physicians that are starting to up their game. That's why we've had such an influx of our consulting clients coming to us. They're looking, hey, how can I do this? Can you help me streamline this? I'm not into business. That's not my background. I need you to help me. We've had a massive influx of insurance-based clinics coming to us asking for help and looking to evolve. And those are the ones that are keeping climbing to the top, increasing their revenue, and they have more passive revenue, and they're buying back their time, which is super important to me to be able to assist our clients with that.
Yeah, if you're an insurance-based practice and you're not evolving to cash-based medicine, you will become irrelevant in the next 5 to 10 years. Fact. It's a bold statement. We'll check 5 to 10 years from now and we can cite this podcast. It's just, that's how it's going to be. You have to provide better care, not because it's the right thing to do, but also because patients are wanting it. Patients are saying, what else do you have for me? And if you don't have it, they're just going to your competitor. So it's very simple. I mean, this is a topic that we could talk about for hours. But.
Well, I loved all these topics that came, and I thoroughly did. I'm going to shut the books on it today.
I was a little nervous. I was a little nervous to figure out what you were going to hit me with. These are topics I'm passionate about. I'm glad people are asking them. And if you have out there other questions and other topics you want us to talk about, message me, DM me, put it in the comments. If you have opinions, I would love to hear them. Constructive opinions, I welcome them. We don't have to agree with any of these topics. That's what this is great. It's a conversation. And I want to hear from you. I want to be able to learn and broaden my knowledge from you. So make sure you comment below, get involved in this conversation, hit subscribe so we can continue conversing. Alicia, thanks so much that was fun. Thank you for that.
Thanks, Sam, for your medical and business expertise. I know it's super important to all the viewers and as well as all the clinics that continue to follow us.
Hey, I appreciate it. And I appreciate all of you. Until next time, we will talk soon. Signing off for now.